Namaste. The knee is one of the largest and most complex joints in our body, which includes tendons and ligaments. Tendons connect the knee bone to the muscle and help move the knee joint, whereas ligaments are responsible for absorbing shock, stabilizing the knee joint, and keeping the bones in the correct position, providing stability to the knee. However, injury to the ligaments due to sports and accidents can lead to severe pain, inability to walk, and loosening of the joints. Today, we have with us Dr. Arun Kannan, consultant orthopedic surgeon, Apollo Hospitals, Chennai, to discuss injuries of the knee ligaments. Thank you, Doctor, for joining us today for our FB Live session.
Hi.
Can you please help us first understand the function of a knee ligament?
So the knee ligaments are for basically to holding together the bones of the knee joint. The knee joint has two major bones. The upper bone or the thigh bone is called the femur, and the lower bone or the leg bone is called the tibia or shin bone colloquially. The ligaments hold these two bones together. That is one of the main functions of ligament. They hold the bones in a stable configuration. So giving stability to the knee joint is the primary function of the ligaments in the knee joint. A secondary function of a different kind of ligament in the knee joint is to act like a cushion or a shock absorber. They are actually placed between the bones and they absorb the impact that falls on the knee joint. So one is stability, the next is something like cushioning or shock absorption.
Can you explain the different function of these ligaments, Doctor?
Yeah, so the knee has many ligaments. 6 of them are the most important. There are 2 ligaments that go right in the middle of the knee joint connecting the 2 bones. These are called the cruciate ligaments. The one in front is called the anterior cruciate and the one behind is called the posterior cruciate ligament. These give stability to the front and back movement of the knee joint, meaning they give stability in one direction. On both sides, on either side of a single knee, we have something called a collateral ligament or the side ligaments as colloquially known. These give stability to sideways movement of the knee joint. They prevent the knee from moving in abnormal directions on the sides. So these two are called collateral ligaments. The one on the inner part of the knee is called the medial collateral ligament. One on the outer side of the knee is called the lateral collateral ligament. Then the last 2 ligaments are called the menisci. One on the inner side again is called medial meniscus. The one on the outer side is called the lateral meniscus. These are the ones that act as a cushion or a shock absorber within the knee joint. So these are actually placed between the thigh bone and the shin bone or leg bone, and when we put weight on the leg, the load passes through the meniscus onto the bones. So this way the force on the bones of the knee joint is reduced by as much as 30 to 50% because of the presence of these shock absorbers or menisci. So the ligaments perform very important function. Whenever you move, the ligaments have to hold your bones together so that they do not move in abnormal directions. That is called stability. And this has to be in multiple directions, meaning in the sides, in the front, in the back. In all these directions, the ligaments hold the bones together. The second thing is whenever we put weight on the knee, put weight on the leg, the ligaments also act as shock absorbers and prevent the joint from getting overloaded and damaged in the long run.
So how can ligaments get injured, Doctor?
So ligament injury is most commonly due to some kind of accident. If you look at the Western world, especially most of the knee ligament injuries are from sporting accidents. However, in our country, a very common mechanism is two-wheeler accidents as well. So knee ligament injuries in our place are almost equal. They are fairly common in sports people, especially contact sports where they can hit against each other and fall. Sports like football, hockey, basketball, these are all called contact sports where a player can go and hit against another player and fall down. So these are more prone for ligament injuries. But even in cricket, which is generally a non-contact sports, lot of cricketers have sustained these ligament injury, especially the ACL or anterior cruciate ligament injury. There are several international players currently in the Indian team like Cheteshwar Pujara, Ravindra Jadeja. All these people have had ACL injuries, they have recovered and they have come back. So sports injury is a very major cause of these ligament injuries. A second common and very important part in especially in our country and especially in our state because of the high prevalence of two-wheelers is two-wheeler accidents. So when you go in a two-wheeler, even at speeds as low as 20-30 kilometers per hour, anything about 30 kilometers per hour is considered a high velocity injury. Even 20 kilometers per hour when you go in a bike, if you fall down, you generally land on your foot, try to balance the knee. When you try to do that, generally the ligaments can get injured if the force is very high. So we almost see an almost equal proportion of sports injuries and these two-wheeler injuries that cause the ligament tears.
Doctor, is fracture and ligament injury the same? If not, what is the difference between the two?
So fracture is break in the bone is called a fracture. So when the bone breaks, we call it a fracture. When the ligament is a soft tissue that connects bone. It is not hard, it is a soft tissue structure, meaning it is a slightly stretchable, elastic kind of structure. When the ligament tears, it's a ligament tear. Sometimes the ligament can tear at the site where it attaches to the bone. That is called an avulsion fracture. These are also considered as or treated almost like ligament injuries. So some ligament injuries can be associated with a fracture, meaning it is called an avulsion fracture. But generally, in general terms, bone breaking we refer to as a fracture. Ligament tears are injuries into a soft tissue structure.
Doctor, it is said that anterior cruciate ligament or ACL as we commonly call it gets injured the most. Is it true, and why is it so?
Yeah, anterior cruciate ligament, as I already referred to, there are two cruciate ligaments in the knee joint that pass in the center of the knee, and their primary function is to hold the bones of the knee joint in position. So of these, there are this anterior cruciate ligament is the one in the front of the knee, and the ligament that is in the back of the knee is called the posterior cruciate ligament. Of these, ACL is the most commonly injured, as you rightly said, and the reason that it is most commonly injured is not because it is a weak ligament, but because it is a very important ligament that is holding the bones together. So if you look at any connection, the one that is most critical is put under maximum strain. So the ACL is probably the most important ligament in the knee joint that is important for stability. So whenever the knee goes out of stability, it is one of the first structures to go out. And the forces, especially in sports injuries as well as in like two-wheeler accidents, it is more of a we call it antero-posterior force or a front to back force. These are because we tend to land the knee in a flexed or bent knee position, and that puts a lot of stress on the ACL ligament and leads to tears. So ACL is worldwide the most common knee ligament injury, or probably the commonest ligament injury in the whole body as well.
So how do we know, doctor, that we've actually injured our ligament in the knee, and maybe what are the symptoms or what are the signs of it?
Yeah, so there is a lot of misconceptions. Generally people come to us around the signs and symptoms. So whenever there is a ligament injury, especially if you are playing a sport, if you've fallen down and if you have injured the ligament, many people even describe or they are able to appreciate that there is some crackling sound inside the knee when the injury happens. That is because the ligament gets torn and it even creates a small noise, and if the sports person or the injured person is able to notice it, they describe it very well and in a very characteristic manner, like a crack sound inside the knee joint once they fell down. But it leads to pain along with this and some swelling as well, but it is not like a fracture where the the injured person is not able to immediately stand after the injury or something like that. Because it is only the stability that is affected, most of the time they are able to stand after the injury with some pain, they are able to walk, and come to a clinic, that kind of injury. A lot of people have this, after my injury I was able to stand and walk, doctor, so I am sure it could not have injured my ligaments. That is generally not true. If you have fractured the bone and it's a weight bearing bone, that is when you are not able to stand. If you have torn a ligament, or if it is an avulsion fracture that involves the attachment of these ligaments, then most of the time you will be able to stand, walk, but with some difficulty manage your stuff for some time before even you go to a doctor. So pain is one of the characteristic early sign or symptom of these ligament injuries. Over time, what happens is, if you have tended to ignore, you have not shown it, it has not been diagnosed, pain generally comes down with time. You might take some pain medicine, icing, some physiotherapy, pain generally goes down. But what happens later is more important. The knee becomes unstable. The main function, as I earlier told you, is to hold the bones in appropriate position, and that is called stability. So when the ligament is not there, then the knee becomes unstable. So how would you appreciate this lack of stability or instability? Most people feel a sense of slipping within the knee joint as they move, especially in certain positions, such as when they are walking or running and they take a turn, they have to balance on one leg and turn. We call it pivoting. In that position, a lot of them feel that the knee is slipping from inside. Or when they are running, they are going upstairs in a fairly quick manner. These activities, they produce this instability or clinical instability, we call it. It gives a feeling of slipping within the knee joint. This is the most important symptom of a ligament injury that you have in the knee. Persistent pain along with instability is very characteristic of this ligament injury. A third symptom is something called locking, and people describe it very characteristically. When some of these ligaments get torn, they can come and get stuck between the bones. Normally they are in a position where the bones are do not get stuck. So if they are torn, they flip inside the joint. So when a ligament flips inside the joint, it is almost like a small stone that is gets stuck in your shoe, and every now and then it will come, it will get stuck and it will cause locking. Meaning, when I say locking, the knee gets stuck in one position and it gives acute pain at that time. But most of the time they will be able to slightly move their knee a little bit with that pain, and once that ligament gets released from the joint, again they will have reasonably okay movement in the knee till the next locking episode occurs. So to summarize, pain with especially activities, this feeling of instability with activities, locking, these are very characteristic symptoms of ligament injuries in the knee joint.
Is age a factor, doctor, for hurting your ligaments?
Yeah, so as I said, the mechanism of injury and the age are very correlative. So as I said, it is mostly sports injuries and two-wheeler injuries, and these are typically seen in young people. So most of the ligament injuries we see are in young people, and that also puts a fair bit of perspective on why these injuries are important. They are generally, sports persons, they are at the sort of at the peak of their careers, or they are really on their way to become sports person, and that's when they sustain these injuries, and this can put them off by a few months or even 1 or 2 years depending on the grade of injury. And young people, working people traveling on two-wheelers, these again are very important socio-economic factors. So these have to be considered. So these ligament injuries often happen in these very active people who are doing something that involves speed. So most of these ligament injuries are seen in young people. The other kind of or ligament injury, we call them as degenerative tears, meaning as the joint becomes worn out in older age, along with osteoarthritis, the ligaments can get damaged. That is generally a part of the arthritis process, and these are seen in older people, generally above 50. So acute injuries are almost always in young people, these kind of degenerative tears where because of arthritis or damage within the knee joint, the ligaments get secondarily damaged. These happen in older people.
Doctor, this is from the patient perspective. From a clinical perspective, what are the various ways of diagnosing knee ligament injury?
So lot of us depend on investigations, but before that I have to tell you that the symptoms I described, they have a lot of bearing on how we diagnose as well as treat these injuries. A patient with instability requires far more attention than one without instability. So pain, instability, all these things that we have to take into account. Along with that diagnosis, along with the history, typical symptoms, when we examine the knee joint, most of us are able to find out what these injuries are. So it gives a very good idea, like in the pre-MRI era also these injuries existed and they were treated quite well. But nowadays the gold standard or the best investigation test to diagnose these ligament tears in the knee joint is the MRI scan or magnetic resonance imaging. So magnetic this MRI scan gives a very clear picture of the bones also plus the soft tissue structures. These are the ligaments. So MRI is a very sensitive and a very specific investigation. It gives detailed images, and with this we are able to diagnose the ligament injuries very accurately in more than 95% of cases. So clinical examination is very important. Along with that, generally supplemented with X-ray and MRI is generally the way to go. MRI is the investigation or the test of choice or the best scan to show these ligament injuries.
Doctor, after injuring the knee ligament, we are supposed to approach an orthopedic specialist. What are the treatment options available today to treat this?
So that's a very broad question. So generally what happens is, as I said, the knee pain decreases. Initially we treat them once you come in with a kind of injury where we are suspecting a ligament injury. We generally treat it initially to reduce the pain, swelling and improve the stiffness in the knee joint. So initially we treat them that way, and then once we have the MRI, we have a very clear picture of what ligaments are injured and how badly they are damaged. So the treatment will entirely depend on which ligament is injured and how badly it is injured. And next what we will base the treatment is secondly the age of the patient, the activity level and how much instability it is causing to the patient. As I said, whatever we see on MRI, what functional effect the ligament injury is having on the patient is the most important deciding factor. A young active patient who has had a ligament injury and has instability will almost always require surgery, especially in the knee ligaments. As far as these ligaments goes, as we are already discussing, the ACL is the commonest knee ligament injury, and this often results in instability in young people. So to prevent instability as well as to improve or to maintain the knee in the long term, these ACL tears that are complete are often treated with surgery. The posterior cruciate ligament, again if it's a full tear leading on to instability in young people, is again treated with surgery, but there are other factors that are involved such as the age. Generally slightly older people we can manage these PCL injuries without surgery, but ACL young people or PCL young active people, then surgery is generally required. As far as the other ligament goes, there are minor intricacies. It depends on how much damage has happened, whether it is in a zone where there is blood supply. All these determine whether surgical treatment is required or not. Apart from surgical treatment, the focus will be on reducing the inflammation and pain initially, improving the knee stiffness, as well as maintaining a good exercise program so that the muscles are strong and they take up some slack from the ligaments while the ligament is recovering.
And it also depends on the patient's condition as well.
Yeah, of course. As I said, the patient's symptoms are most important, so that guides us to whether the knee ligament injury is causing instability in an active manner. So let's say a patient who is 18 and has a ligament injury is different from a patient who is 50 and has a ligament injury. So multiple factors, age is one consideration, the clinical symptoms, the grade of the injury, all these have to be taken into factor. But in general, most of these ligaments can be treated quite well, and we just have to look at the grade of the injury and the condition of the patient to determine which is the most appropriate treatment.
Doctor, you mentioned surgery as one of the options to treat. What are the various surgical options available today to correct the knee ligament injury? And does that also have different factors to consider?
Yeah, ACL being the most common ligament, when it is torn from a bone or if it is cut in the middle, we have to do something called a reconstruction, meaning it is not possible to stitch them end to end with just a stitch or something and expect them to heal. What we do is called a reconstruction, not a repair. When we just stitch, it is called a repair. In reconstruction, what we mean is we take additional tissue and support the ligament along with the bone, so that there is a new tissue that is in place of the ACL. We usually take a tendon graft or a tissue graft and place it along the ACL and fix it to the bones above and below. So this is called a reconstructive procedure. Most often used is a tendon from the back of the knee. It is called a hamstring tendon. We use this tendon, we reconstruct the anterior cruciate ligament. And one of the major advancement over the last maybe it was not yesterday or 10 years back, 20-30 years back, the arthroscopy has been a very useful tool. Arthroscopy is similar to laparoscopy or endoscopy that we do for general surgical procedures. Arthroscopy means using a small tube to enter into the joint instead of an open surgery. So two holes are made through one small hole or a keyhole. The arthroscope or a tube camera is placed inside. We are able to look into the knee joint, and through another small keyhole we are able to bring in our instruments, and under vision we are able to do the surgical procedure. So all these ligament injuries almost always are treated by arthroscopic surgeries and not open surgeries in current times.
What are the benefits of these arthroscopic surgeries, doctor?
So arthroscopic surgeries, one is the invasiveness of the procedure. The first thing is, instead of having a big incision, you just have two keyholes. It does not stop with just the skin incision being smaller. The muscle cutting is not happening because we are just entering through keyholes, and we are doing very minimal damage to the other structures in the knee joint, and it also gives unparalleled accuracy. Sometimes in difficult areas to reach in the knee, even through an open procedure, the camera can go and access. So it gives as good or better visualization than even open procedures in certain conditions. So arthroscopy or this keyhole surgery is an excellent tool. So less pain and faster recovery because of less damage to the muscles as well as to the surrounding tissues.
And there's also lesser blood loss.
Yeah, of course, very minimal blood loss we have with these keyhole surgeries. Most of these are done as daycare procedures, meaning we admit the patient in the morning, perform the keyhole surgery, and they are gone home the same night and they are sleeping in their beds.
We'll take some questions from our viewers, doctor. My friend is a sports person and has injured his ACL. Non-surgical methods of healing have provided him with no or very less relief. Doctors have suggested surgery, but his main concern is the recovery period post-surgery. What would be your advice?
Yeah, as we were discussing, ACL is in young people who are active, generally complete tears are treated with keyhole surgery, and keyhole surgeries are generally performed in a daycare manner, meaning we operate the patient within 3 hours or 4 hours. They are beginning to eat and drink something, and once they are steady, we make them stand, walk with the help of a couple of sticks in the recovery room itself, and they are sent home with sticks and they are able to walk. They can even climb to the first floor and get into their homes. So first 1 or 2 days they are resting at home. After 2 days they are taught to walk with sticks quite freely, and then we do a dressing change and start the knee bending right away. So if you are looking at walking alone, it is started from day 0 or the day of surgery within few hours. First 15 days or so, we encourage them to have a couple of sticks so that they just support themselves, they do not go off balance. After 15 days, it's generally a single stick just for a little bit of support they use for a period of 1 month from the time of surgery. So they are generally allowed to put as much weight as they can tolerate. Almost they put on full weight immediately after the ACL reconstruction surgery. Up to 1 month they are walking with the minimal supports like a single stick or 2 sticks. By 1 month, most of them are back to routine or less intense daily activities, walking, climbing stairs, sitting on a chair and getting up. All these they are doing fairly comfortably at 1 month. And then slowly we return them to normal activities. Generally they can drive a 4-wheeler at 1 month. 2-wheelers generally I ask them to drive after 2 months so that they are safe. So 2 months 2-wheelers, 3 months they can start jogging and short runs that are not very intense, and they can start sports specific training as well. A lot of our sports person who are like they are playing at some professional level, they are trying to get back into sports. So we begin sports specific exercises by even 3 months after the surgery. By 6 months, a lot of them are even ready to get back to non-contact sports like cricket and such sports. A typical example is Mr. Ravindra Jadeja. He had an ACL tear about 8-9 months back. He had an ACL surgery, missed a couple of series, and then he was back with the bang in the series in India, and he was man of the series in the very first series that he played again. So that is the period of recovery. So I don't think there is much to fear regarding the period of recovery. Most sports persons are able to get back to the level of sport that they were playing. In football, which is probably the highest demand sport as far as ACL is concerned, about 70% of them are back to what level they were playing by 1 year.
Hello, doctor. A few years ago, my friend underwent surgery to correct a knee ligament injury, but now she's experiencing the pain again in the same spot. Is there a possibility of recurrence? What is the severity of it, and what would be the treatment? Would she have to undergo the surgery again?
So failure after ligament surgery is, I must say, fairly rare because the techniques have evolved quite well and very reliably reconstructed. As I said, most even sports persons are able to get back to their level of sport. But like any surgery, like any treatment, there is no 100% one way or the other in ligament surgeries. There will be 1 or 2 patients who had problems, and these can happen, meaning the ligament that we put in is about 90% or so as strong as the ligament that was there before. So it is not like a ligament that is 200% twice as strong as the one that was there before, and it can never get damaged again. So it is about 90% as strong most of the time as the ligament that was there naturally, and which is a fairly, we are able to restore 90% of the strength of the ligament. So if you go, have an injury again, you can definitely re-injure your ligament. It is not impossible. So if your friend has had a ligament surgery and is having problem again after these few years, it needs to be checked whether there is instability. But not all the knee pain after a knee surgery has to be from the same ligament. So it is very hard to localize whether it is from the ligament just based on knee pain. Let's say a person who is 40 or 45 has a knee ligament injury and has developed knee pain at the age of 50 years. It may not be related to the ligament at all. It might be from something else like the cartilage wearing out, like what we call as chondromalacia or early form of arthritis. So it needs to be examined. We need to get some imaging tests like X-ray or MRI and see whether it is the same ligament that is causing the knee pain or if it is something else that has come up.
Hi doctor, yeah. I have knee pain suddenly after getting up from the bed every day. What are the ways that one can injure their knee ligaments, and have I injured my ligament in the first place?
See, knee ligament injury without you noting it without it being an event like a fall from bike or at least a fall from stairs is fairly rare. It is not impossible that, but it is a fairly rare event for you to just develop a knee ligament injury all by itself without you noting the injury mechanism or the injury event. But it can happen. But if you are having early morning pain just when you are getting up from bed, can be two other things that need to be thought about is, when you're having knee pain after a period of rest, we call it as startup pain, and it can be seen in inflammatory conditions, something like a synovitis or early form of rheumatoid arthritis. All these cause early morning pain and stiffness. It tends to be there for about half an hour once you wake up, and then slowly disappears as you continue your activities. So that is one thing that you have to be concerned about. The third thing is about whether the position at sleep or something is straining the knee in such a manner. People with early arthritis also develop pain at night or in the early morning because if they are sleeping on the side with the knees against each other, that is also a possible cause of early morning pain.
My brother fell down and fractured his leg. Is it possible that he is experiencing a knee ligament injury as well at the same time?
So, combination of a fracture with a knee ligament injury can happen, but they are little bit unusual, meaning they are not very common, but it is definitely possible. It can damage the ligament as well as fracture the bone. That depends on the mechanism of injury. So initially when we see a fracture patient who has come in with in a knee injury, the first thing to get addressed is the bone. So first we fix the bone because we need the bones to be stable and good for them to have good ligament stability. So first we would fix the bone, and generally right now most of the good quality implants that we use are stainless steel, or they are, even if they are most of them are titanium, and even if they are stainless steel, they are MRI compatible. So after we fix the fracture, if there is a suspicion of a knee ligament injury, then we can get an MRI scan and check if there is a ligament injury. If there is a ligament injury, that can also be treated once the fracture has been taken care of. First we have to take care of the fracture, then we have to take care of the ligament. So it is possible, once we fix the fracture, we will know if there is some laxity or instability in the knee joint, and if it feels that way, we can go ahead, get an MRI and find out the cause of or the exact pattern of ligament injury and address it.
What would be your message to our viewers today, doctor?
Yeah, so knee ligament injuries are fairly common, especially in the younger age group. Very common form is sports injury or these two-wheeler injuries, and the one thing that I would say is not to ignore these injuries. Once you have ignored a knee ligament injury and it causes instability, it causes further damage in the knee joint. When the knee is unstable, once like say ACL has torn, if you have not taken care of it, in time it leads on to a meniscal injury also. So it is not something that you can ignore and carry on as usual, especially if you are active. So if you are having symptoms of knee ligament injury, get it checked and get it addressed. Thank you.
Thank you, doctor, for patiently answering our queries. I'm sure it's benefited our viewers. For appointments with Dr. Arun Kannan, consultant orthopedic surgeon, Apollo Hospitals, Chennai, please contact 044 4040 1066. I repeat, 044 4040 1066. Thank you, doctor. Thank you, viewers.